Scared me.
Talks to you. That's weird. Okay. This is we're group 2, yeah. Group 2's IPE. Our interview results, our interview answers, I should say. So our first question on the list was, what are some of the most common medication errors you see? The person I interviewed is Dr. Kyle Brunix. He's a doctor of internal medicine in Rayville, where I live. And he said that the most common things would be things like incorrect dosages. So a patient that is given the wrong dosage, or sometimes completely incorrect medications or expired medications.
I interviewed Miss Ann Burnham. She is an LPN, and she agreed about the failing to administer the correct dosage of a medication and failing to identify drug contraindications beforehand.
Okay, I interviewed Nicole Ritchie. She's a registered nurse. She works at Oshner's, and she's actually my stepmom. So I interviewed her, and she also kind of said the same thing. She just said, given the incorrect medication, or given the wrong dosage or strength of a medication.
Okay, so I interviewed Isaiah Delaney, which he is a respiratory therapist. And so respiratory therapist, he said that we give bronchodilators and other treatments through many different methods. And he said a lot of times they'll order the right dose, but it'll be an incorrect frequency or modality.
I interviewed Dr. Terry Wilson. She's a nurse practitioner for labor delivery. She said one of the most common errors in her hospital is improper fetal monitoring.
And so next one, this is, have you ever seen somebody given a medication that was, please help me with this word, contraindicated? Is that right?
Contraindicated.
Thank you. This is not my field. And how did they handle it? So my interviewee, he said that the example that springs to mind is medications that would be given under normal circumstances, but medications that should not be given to a pregnant woman, and maybe someone who is either early enough and they don't catch it that they are, or that it just, they just didn't know. And in that instance, they cease use of that medication, find an alternative treatment, and obviously make sure that there's not going to be any ill effects from the treatment that was given.
Interesting. I didn't know that happened pretty often. Miss Ann said that after she identified that another healthcare provider had administered a medication that specific patient was allergic to, she immediately reported it to her nursing supervisor and medical provider. And the medical provider gave orders from there, including monitoring the patient's heart rate and pulse and their oxygen levels, as well as sorry, can't talk. Antihistamines, corticosteroids, and epinephrine.
Okay. Much more in-depth of events.
Was that all of yours?
Yes.
Or are you done? Okay. I didn't want to interrupt you. Okay, so Nicole kind of said the same thing about if like someone doesn't know if they're pregnant or not, that's a big issue, and to report it and try to give another medication that maybe like wouldn't interfere with pregnancy or them being pregnant or anything happening in that sense. And they weigh the reason of like choosing one medication over the other because of those things.
Okay. So kind of like touching on what not Anna, Caitlin said, that from a different perspective. So usually when a patient has allergic reaction or something like that at his hospital, they call a rapid response. And so the RT always has to respond to that. So in that case, it was the same kind of situation. They gave a medication she was allergic to. And so the doctor ordered breathing treatment for her. And he also had to put her on oxygen in that situation.
Okay. She said no, but if she was to see a situation like that, she would definitely report it first.
All right. And then what are we at? How does communication affect medication safety in the workplace? And my person, he said this, communication's key. You need to communicate effectively, not only with your colleagues, but also with the patient. If you have clear communication, you're going to have more understanding, more accuracy in statements. If you don't have that communication, things are going to get lost in translation. Things are going to get, they're going to slip through the cracks, and people are going to pay the price for it.
Miss Ann basically said the same thing. She said it helps reduce errors because there's trust that's developed, and you can also inform patients or caregivers and let them, know possible causes or side effects or anything like that, so they can make an informed decision, and as well as colleagues, because if there isn't clear communication there, then they might not do what's best for the patient.
Nicole pretty much said everything. That communication is definitely important in the healthcare field. And she went off of like I guess like the patient side of it. And she was like, a lot of times patients come in and they don't express fully like all of their health concerns because they're embarrassed. And she said that plays a huge part in like, whether or not they're given the right medication or whatever. And so she just went back and said that communication is very important.
Okay. So my interviewee, he kind of touched on, especially like when there is an emergency, and a lot of times the doctor is like giving verbal orders on what kind of meds to give, what they want. So a lot of times he said that he has to repeat the orders back during and make sure that he's heard to confirm a dosage or frequency, because a lot of times if not, the wrong thing will get ordered or the wrong thing could be given in that situation.
My interviewee said the less communication, the more errors you make.
Absolutely true. I think that's true of just about anything. So what is the first step that you take in reporting a medication error? He said that you have to document it, report it immediately. He said reports are made to USP, and then that information is also given to the FDA and the ISNP, and that information can help other instances of the same error get stopped before they happen.
Miss Ann said that the first thing she would do is report it and then assess the patient for any reaction to the error in medication, and then notify the prescriber of the medication.
Nicole basically said the same thing, just to immediately report it so that if anything had happened to the patient or whatever, they can treat it immediately, and to also identify the medication.
Yes. So Isaiah said that first, of course, report it to the healthcare team, the nurse, the doctor. And he said at his hospital that they have a reporting system. So everything has to be documented, of course. And that goes to like a team, and then the team will address it and escalate it how it needs to be handled.
I think we can all agree that our interviewee said the same thing. Mine said she would immediately write a detailed report and continue to monitor mama and baby.
what are ways you could suggest to cut down on medication errors? He said, obviously, like we talked about before, communication is a big one, and also paying close attention to a patient's chart and making sure that the patients themselves understand their medication. Because I know sometimes there are people who take things and they're, I don't know what this is for, and there's half the problem right there.
Yeah. She said to clarify drug dosage, frequency, and other details with the pharmacy and medical prescriber, as well as recheck the drug calculations to make sure, and monitor for allergies and contraindications before administering the drug.
So my interviewee said always check the labels and the dosage of the medication. And so, I don't know why people do this, but she said some people do like put their pills in like a different container that's not labeled. And so she said always make sure to keep the drug stored in its original container.
Okay. So, mine as a respiratory therapist, he said that always, you verify patient identifiers like name and date of birth first before giving a medication. And also, like, if an order just seems wrong or incorrect, or you're questioning why is this patient getting this and there's no indication for it, just verify with the nurse or the doctor to make sure that they're supposed to be getting that med.
She said communicate with your inner circle, educate yourself on the patient status and the chart, and you have to be able to empathize with the patient.
And the next one was, what role do you play in both catching and correcting errors? He said, in catching errors, mainly noticing that something isn't right, whether that's through symptoms or through reviewing a patient's medications. In correcting it, make sure that the correct medications are given or administered, correct dosages and everything, and then following up with the patient to make sure that everything's fine.
As a nurse, Miss Ann is one of the last safety checks in the chain of medication administration before they actually get to the patient. So it's important for her to interrupt medication errors before they actually reach the patient, especially since it's went through other people before her. And she told me about the 6 medication rights, which are the right patient, the right drug, the right time, the right route, the right dose, and the right documentation.
That's cool. I did not know that, but that's kind of cool.
I really like that.
Yeah.
Nicole also kind of said the same thing as you, not the whole last part thing because I didn't know that, but she said report all medication errors, and obviously like try to catch them before they get to the patient. And then she said after that she tries to figure out which medication that the patient was actually meaning to get, like the one that they needed for whatever issue that they had.
Okay, so Isaiah said that for each patient, before he gives a breathing treatment or a med, that he has to verify their information in the computer before giving any treatment. So he said basically to practice like good habits. Some people that he works with, he knows that they might start a treatment or start a med before verifying the information in the computer or verifying the patient's wristband. So for him, he always makes sure that he verifies that before he even starts the treatment.
My interviewee said just making sure your patient feels safe and heard and verifying their information.
Okay. Were you given advice as a student or intern on how to handle situations regarding reporting medication errors? And he said that the main advice was to handle the situations both quickly and thoroughly. It's going to have, it's a balance where you got to get this stuff done quick, but you got to make sure it's done right, or you're going to have more problems than you solve.
Mhm. Miss Ann said that she was, and they basically kind of went over and told her again what to do, which is notify the RN supervisor and physician, identify actual or potential adverse reactions from the error to prevent or stop them from worsening, document is how she worded it. And then identify why the error occurred and how to prevent it from occurring again in similar situations.
Nicole said yes, that when she was an intern, she had 3 weeks of just training specifically for that. And she said the main thing is to just handle it as quickly as possible.
Okay, same kind of response for me. He said that as a student, his preceptors made him ask every patient their name and date of birth. And as soon as he walked into every room, so he could create that good habit. And if anything was to happen, to always, document thoroughly, make sure everything is accurate with that, and so that the team knows what happened.
My interviewee said you have to follow through any of your documentations, rather if the error is your fault or a coworker or even a doctor.
Let's see. What are some common health disparities that you run across? He said the biggest one that he sees is people not being able to afford care and treatment, and sometimes that is attributed to insurance not covering the necessary treatments, and sometimes that's attributed to being in a more rural area, which limits the care that people actually have access to.
Miss Ann gave me quite a few, and that was the first one she actually said. She said uninsured patients or underinsured, and she also included lack of access to proper health care or healthy food, limited support system, and language barriers.
Nicole actually gave me two that you just said. She said language barriers and lack of access to care. And she meant like, if insurance doesn't cover it, you can't get the type of care that you need, and that some people like really desperately need to get better. So
Okay. So Isaiah said that he sees a problem with non-compliant patients, um, due to like lack of education. That he sees, a lot of people they read like maybe at a third, fourth grade level, so they don't understand why they should be taking a medication. So then in turn, like they're non-compliant, and then eventually they don't refill the prescription and they just end up back in the emergency room for the same problems.
Okay, Terry said basically the same thing. Non-compliance, basically most of their patients that they get are African American, so they don't feel heard. So she said most of them have Medicaid, um, and African American women fatality in childbirth.
And then, what would you consider to be the number one issue involving a career in healthcare? He says for him, it's too little time with patients. When you've got a lot of patients and you're the only doctor in the clinic, it's split. Yeah, you got the NPs there to help, but you've got a lot of people that you need to see, and you got only so much time, and it stops the patient from getting the time that they really need to be heard and to be taken care of.
Miss Ann said that it was job burnout due to staffing shortages because most days they have to work like super, super long shifts. That's actually why I couldn't get the interview done until late last night, is because she had 16 to 18-hour shifts the last 2 weeks. And last week or yesterday was her first day off, and I don't even know how long. So that's a big thing for her. And so outside of her working those hours, she doesn't have much time to sleep or spend time with her family or anything like that. So she said that's her main problem.
Nicole said it sometimes feels like you're always in a constant rush. Like there's never enough time to get anything really done. And she said she's like some days can feel like you're so overloaded with stress because you're so worried about your patients and paperwork and coworkers and all the things that go into working in the healthcare field.
Okay, so he said, especially since COVID, staffing conditions have been terrible, and he sees it happening everywhere. During COVID, a lot of the staff left to travel and do travel assignments. And so ever since then, the staff hasn't really replenished. So the staff that they do have really high workloads and have a lot of patients.
Oh, are y'all able to see me this entire time? Like,
Yeah, we can see you.
Yeah.
Yeah, we can see.
okay. Okay, y'all can see me this entire meeting or just no?
No, entire, yeah.
Okay. All right. Okay. I'm sorry. Okay. She said worker burnout and most of the staff feels underpaid.
Then I think our last one was, how well do you work under pressure in the healthcare field? And his response was, as well as can be expected. He tries to focus on the patient, but because there are so many, because you do get into that rush, you got to try to, think, slow down. Let's focus on this and then get to that. And he helps provide options and helps people work through those options until they find what works for them. And he handles it the best he can. That's going to be expected.
Miss Ann said that nursing is a high stress job and it requires you to work well under pressure. But she said she actually works best under pressure because she has good time management skills, the ability to maintain emotional strength in difficult situations. She has extremely good attention to detail and organizational skills.
So going off of that, Nicole kind of said the same thing, that she works better under pressure. She's been a nurse for quite a few years. So she says she's kind of gotten used to it over time. And she says she kind of gets this like adrenaline rush and she gets things done way faster. And she said it's not always easy by any means because obviously if you're under tons of stress, like that's not easy. But she said she gets things done faster, even though it's not always easy, but there's certain skills that you have to like acquire along the way to be able to do it.
Okay, so Isaiah said that as a respiratory therapist, his job requires him to respond to pretty much every emergency or if there's a code blue in the hospital. And a lot of the rest of the team, like nurses and doctors, will say that respiratory is always the calmest in the room. So he said that they are trained to make decisions under pressure, and he says that he works well.
Terry says she has a 3-year-old daughter, so she was made for pressure.
Feel that in my soul. All right, I think that does it. That is our questions, and those are our results. I will stop the recording here in a second, and I'll go and get this submitted in Moodle.
All right, sounds good.
All right, thank you guys.
Bye.